At home. I am joined by Dr. Jason Liu from Lexington Medical Center. Thanks for being here.
It's a pleasure.
Yeah.
I'm excited to be here.
So tell me a little bit about you. I know you're new to Lex Med.
Columbia, South Carolina is the only home I've known as a physician since residency. I started working here in 2019. A few months ago, I jumped over to Lex Med because it's the best in town.
Best in town.
I do internal medicine, which in an outpatient setting in this day and age is mostly adult primary care. So anyone 18 until whenever.
Awesome. Good stuff. Well, you're the perfect person to chat to about this.
Yes.
So big question. Why is men's health important? Why should we know things about men's health specifically?
So one thing that a lot of men run into is they don't like to see the doctor. I had that issue up until I became a doctor myself.
I'm sure.
And there's a lot of things we can get to earlier in life, and sometimes the only cure really is prevention for a lot of things.
Yeah. Why do you think that is, that men are slow to go to the doctor?
Well, a lot of it's just the nature of us men. We think we can solve a lot of problems ourselves. We think a lot of things will go away, and sometimes it's a little hard to ask for help, and sometimes it involves these details we really don't want to talk about, and we're afraid of how we might be perceived, how we might be judged, but it's really important to get it out of the way.
Absolutely. And, I think something that's super important is preventative measures, right? Going regularly to the doctor just to check in, even if nothing's wrong. Screenings are very important, especially for men. What screenings should young men be going to the doctor for? Sometimes
a lot of these tests when we're younger, they're not always useful in a vacuum, but it can become more useful when we ask about family history. What are your parents going through? What are your siblings going through? And sometimes the most important screening is just questions: family history, medical history, asking if we missed any childhood vaccines. Another issue in this day and age is STIs, getting that out of the way.
Absolutely. All right, what about our men about age 40?
40's that age where our bodies really start changing, and this is where the testing broadens. We're talking about cholesterol screenings, diabetes screenings, basic electrolytes, and sometimes by 40 we have some other conditions that are popping up, and we just want to make sure those are also getting checked as well.
Absolutely. And then what about our older men, 65 and older?
So by the time most people are 65, they've really changed, and they may have even been on medications for a while. Sometimes taking those medications can change your body. You want to screen for osteoporosis if you notice you're getting shorter, and you just want to even dementia screenings when we're older, making sure our wits are with us. And one challenge I commonly run into is I deal with a lot of smart people, and they can fake being in good shape.
It kind of leads me to my next point, mental health. It's hard to talk about any gender, any age, but I think for men, it's even harder to bring that up to a physician or even to a family member or friend. What's important to know about men's mental health?
What's important to know is that it's never too late, it's never too early to just ask is do I have to feel this way? Does it have to stay like this? And sometimes the answer is no, it doesn't. We can do things about it. We can address it.
My last question for you, men's mental health, men's physical health, also important.